Hi everyone, and welcome to my channel, Dr. Coco's Medmonic. Today I'm going to be going over the disease multiple myeloma, and the reason I'm making a video for this specific disease is I've had multiple questions on it, on NBME, on STEP, on UWorld, and it seems like multiple myeloma is really high yield, but it's a disease that I really don't remember learning in medical school, so I'm going to make a quick video on it. So multiple myeloma has that M spike on serum protein electrophoresis, and that M spike is specific for multiple myeloma, but also like all of the plasma cell dyscrasias will have some type of spike on that serum protein electrophoresis. The way that first aid has is they put it as crab, and I don't know how crab came to be for multiple myeloma, but I actually really like it. I like crabs. I like seeing them at the beach, and I like eating crabs. So I was like, okay, we're gonna do crab as our mnemonic, but I'm gonna add on to it. So this is the crab that they put in first aid. So we have hypercalcemia, renal involvement, anemia, bone lytic lesions. And so if you have a patient, a little bit older patient, and they say, oh, like my back really hurts, and the first thing you're thinking, okay, they have osteoporosis, right? And then you like run a bunch of labs on them, right? And you see, okay, they're anemic. That's a little weird. I'm still kind of like thinking either they have osteoporosis, or because they're anemic, maybe they have some type of cancer that spread to their bone. And then you're like, okay, but then I get this high calcium level. And then they're like, oh, by the way, doctor, I'm having some peeing issues. Okay, this is like red flag right there. You need to know that is multiple myeloma. And I feel like these questions are so very vague, and the patient will be like, oh, well, I'm older, but like sometimes my back hurts. And then you run, the labs on them, and they're anemic, but they have high calcium levels. Like, you just gut reaction, you need to think crab, okay? But what's the second crab? So this is the one in first aid, and then this is the one that I came up with. So if you can remember crab for their symptoms, you can maybe remember crab for the pathophys of multiple myeloma. And so that'll be for a clock face chromatin with IgG. So that'll be what you see on histology, is that clock face chromatin, as well as the Rolodex formation of erythrocytes. I'm probably pronouncing that wrong, but they call it like a stack of coins, and so they're really just right next to each other. Nothing else looks like that when you do a blood smear. A is for amyloidosis, and the AL for light chain, and that's kind of the light chain that you'll see on the electrophoresis. But you'll have renal amyloid deposition in the mesangium, and so that's kind of helping you remember that renal involvement too. So you have amyloid deposit in the kidney. And I've had multiple questions. I didn't realize that this was like associated with an amyloidosis, and that'll be the answer choice. And I'm sitting here like, oh, it's crab, it's multiple myeloma, and the answer's gonna be like amyloid deposition, or the green birefringence, or Congo red, or something, and I won't get it right. But now I will, because guess what? We remembered crab. There's crabs all over the slide. And last is B for Bence-Jones proteinuria and IgG light chains. And Bence-Jones is specific for multiple myeloma. The Rolodex formation specific to multiple myeloma. So if you can remember crab, and there's two crabs, the crab symptoms and then the crab pathophys, hopefully you'll get every question on multiple myeloma correct. And like and subscribe to my channel. This is Dr. Coco.